Welcome to the Wednesday, July 25th edition of the Daily News Podcast. I'm Mary Ellen Schneider.
And I'm Terry Rudd. Today, why weight loss requires more than just a bariatric procedure.
Also, how a longer span of reproductive years shapes dementia risk.
And physicians sound off on possible dramatic changes to how Medicare pays them.
But we begin today with a fish tale about fish oil. A Cochrane Library review finds fish oil's vaunted cardioprotective reputation is all wet. In fact, boosting two components of omega-3 fats, mainly through supplements such as fish oil, has little or no impact on cardiac health or overall mortality. The skeptical researchers agree that fish oil's EPA and DHA reduce triglycerides, but the facts of the story show supplementary omega-3 fats probably aren't useful to prevent or treat heart and circulatory diseases. The World Health Organization commissioned the closer look at fish oil's purported feats. The researchers focused on 79 studies that boosted omega-3 fat intake using EPA, DHA, and ALA. How did omega-3s measure up for heart health? According to the meta-analysis, increasing intake of long-chain omega-3 fatty acids had little to no effect on all-cause mortality, cardiovascular mortality, cardiovascular events, coronary heart disease mortality, and arrhythmia. Worse, there was a potential slight boost in stroke risk. Increased ALA intake showed little or no effect on all-cause mortality and cardiovascular mortality or coronary heart disease events, but there's a possible decreased risk of cardiovascular events and arrhythmia. Why have some earlier studies suggested a significant effect, convincing millions of Americans to add fish oil pills to their diets? The researchers say previous suggestions of benefit appear to spring from trials with higher risk of bias.
Endoscopic bariatric procedures have become routine practice, but they're much less likely to deliver meaningful weight loss if they aren't paired with frequent patient contact and a multidimensional lifestyle intervention. That's the advice of Dr. Shelby Sullivan from the University of Colorado, Aurora, who spoke at the annual Digestive Disease Week. Regardless of which endoscopic intervention a clinician uses, successful and complication-free weight loss requires a comprehensive approach after the procedure. The key to weight loss success? Patient contact. Dr. Sullivan cites research showing a weight loss program with at least 14 interventions with a patient over a 6-month period led to a 5% greater increase in weight loss. Those intervention episodes don't have to be one-on-one. They can include group sessions, telephone consults, and even online coaching. Another tip from Dr. Sullivan: have protocols in place to prevent and, when necessary, manage potential complications. That could involve administration of additional antibiotics beyond what's used for prophylaxis, treatment with additional IV fluid, and imaging.
More pregnancies and a longer span of reproductive years appear to confer some level of protection against dementia. The link suggests lifetime estrogen exposure may be an important modulator of long-term cognitive health. That's according to research presented at the Alzheimer's Association International Conference. The study is the first to examine this question in a large cohort, comprising more than 14,000 women with up to 50 years of follow-up data. Dr. Paula Gilsands of Kaiser Permanente in Oakland, California, led the study. She and her colleagues analyzed data on 14,595 women in the Kaiser Healthcare database. Women with at least 3 children were 12% less likely to develop dementia, compared with those with 1 child. That association remains significant even after controlling for age, race, educational level, and hysterectomy. Miscarriages also influence the risk of dementia. Women who didn't report one were 20% less likely to develop dementia than were those who experienced at least one. A shortened reproductive time span increased the risk of dementia. Women who had their first period at age 16 or older had a 31% increased risk of dementia. Those who had their last period at age 45 or younger faced a 28% greater risk. Each additional year of reproductive capability was associated with a 2% decreased risk of dementia. Dr. Gilsand says the findings suggest reproductive events that signal different exposures to estrogen may play a role in modulating dementia risk.
Physician associations are expressing mixed feelings about dramatic changes proposed for the Quality Payment Program, or QPP, by the Centers for Medicare and Medicaid Services. Under its 2019 QPP proposal, CMS plans to remove 34 process-based measures that are considered to be low value or low priority. CMS also wants to streamline the interoperability performance category within the Merit-Based Incentive Payment System, or MIPS, to simplify scoring. For the first time, CMS is proposing to allow physicians to opt into the MIPS program if they're prepared to meet the program's requirements. The American College of Physicians says it's pleased that CMS proposed the removal of a number of quality measures deemed to be of low value. But ACP officials are disappointed that CMS didn't heed their calls to streamline MIPS requirements and scoring or reduce the total number of quality measures. The American College of Rheumatology warns that a CMS proposal to eliminate the MIPS small practice bonus as a standalone bonus could hurt small and rural providers. Comments on the proposed rule will be accepted at regulations.gov until September 10th. And that concludes this edition of the MD Edge Daily News. You can subscribe to the Daily News wherever podcasts are found. For MD Edge, I'm Terry Rudd.
And I'm Mary Ellen Schneider. As always, you can find these stories and more at mdedge.com.